One of the most common things we see in the office is that our patients have neglected their necks.
Don't neglect your neck, protect your neck. One of the issues that I actually see is a lot of people, their neck will look 20 years older than the rest of their body. So I'm Dr. Shah. Welcome back to our channel.
I'm Dr. Maxfield.
And we always talk about all things skincare and dermatology. And of course that applies to the neck because the neck and décolletage have skin on them. So we're going to be talking about the common issues we see on the neck. We're going to talk about how to protect the neck, and we're going to talk about how to treat those issues. So all things related to the neck and décolletage, here we go.
Here we go. So I'm going to take this off, but we will talk about this craziness later when it comes to treatments.
So let's talk about the skin on the neck and whether or not it's different than any other part of the body. The face has a lot of oil glands. It has a lot of hair follicles, especially if you have a beard. But the eyelids, I always argue, is the thinnest skin on the body. It has less oil glands. It has less reparative properties. It's very, very thin and can get irritated easily. So is the neck any different than the rest of the face? It is slightly different.
And it's actually hard to quantify. I was trying to think of what's the best way to describe why this is the case, but I can't tell you. But the neck is a more sensitive area in terms of skin sensitivities than the majority of the face and probably the rest of your body. So when we talk about body care, when we look at the neck, we need to treat it like any sensitive skin.
So does that mean that you need some special type of neck creams? I'm going to argue against that later on in this video, but we're going to be talking about what we commonly see on the neck and décolletage. So there are three main things that we see. One is those horizontal necklines that a lot of people call tech neck. Another thing that we see is this mottled hypo, and blood vessels and redness that occurs on the neck and chest, and this is called poikiloderma.
Poikiloderma is a technical term where you have a combination of dilated blood vessels alternating light and dark spots. And I can't tell you how many patients come in. It's a really common complaint. They say, I've got a rash on my neck and it just won't go away. It's been there for weeks, it's been there for months, it's been there for years. I got bit by a spider and now this all of a sudden showed up, which is usually wrong. But it catches people off guard. But it's a universal change we see in people who live life outside for good or bad reasons. And then they develop this because they neglected the neck.
Another common thing that we see in this area as dermatologists is skin cancer. So we see a lot on the neck for sure, but we also see a lot on the décolletage, and it's difficult to hide a scar on the décolletage because there's no crevices or creases to hide them in. So this is a difficult area to treat, so you definitely want to protect it. So let's start at the very basics on how to treat this. We always have to start with protection. Today, or tomorrow, or the next day, you can begin protecting your neck by simply taking the sunscreen that you are applying to your face and then drag it down to any exposed areas on the chest and on the neck.
I've been trying to be more deliberate about showing this to you all in videos because, we're making videos, like we're just demonstrating product usage, blah, blah, blah. We wipe it on our face. So I've noticed I'm trying to, even though this is just like a demonstrative effect, like put it here just as a reminder that this is an area not to be neglected, if you will. But it's an extremely important step. And it's actually a very simple integration because you just use here, move it down. There are some caveats, but that is certainly the best first step you could do to take care of this area.
Now, as far as topical skincare products that you want to apply with this, you can simply take whatever you're doing on your face and drag it down onto the neck and the décolletage. This is your antioxidants like vitamin C. This also includes your retinoids. Now, that being said, similar to the eyelids, but much less severe than the eyelids, the neck is going to be more sensitive. And because of that, you may get more irritation with your retinoids than you would with other types of products. This doesn't mean that you need a specific neck product. I actually strongly believe that you don't. When you look at most of the popular neck products out there, they have the peptides, they have the retinoids in them, maybe at lower concentrations, but you don't need a moisturizer just for your elbows or your knees. These are all going to be essentially similar body parts, right? So you don't need very, very specific. I think it's just adding more waste to your routine. So just drag them down and maybe apply your moisturizer before your retinoid just so that it can insulate you from that irritation.
Your cleanser can be your body cleanser. Your active ingredients can be largely the same. Your vitamin C, your retinoids, your peptides, whatever you're using, move it down. Same steps throughout the day. And then sunscreen. It's just like, don't neglect this area. You're very good about putting it on the face. Maybe you're good about putting it on the arms, but just take it down.
So beyond the topical treatments that we have some at-home devices that you can use for the neck, the most common being LED. Now, if you've watched our videos in the past, we've talked about the benefits of LED in general.
So LED, a form of photobiomodulation where you're using visible light in this sense to stimulate collagen, rejuvenate the skin. The benefit is it's extremely gentle. The device I was wearing earlier, and I'll show it to you here. This is one from Cure. They make the mask we love. So it's just a nice, simple product. You wear it around your neck. It's a short period of time throughout the day. The hardest part is just consistency. It's building new habits. There's really no limitation for a person to use this type of device. It's just fit it into your schedule, and it just takes a few minutes a day. There's really no downside to something like this except for the cost. But unlike your skincare products, it's a one-time investment. You just have to think of it differently.
So that LED light, it targets fibroblasts to increase collagen production and will have those anti-aging benefits. So especially if you get that tech neck, which is the lines in the neck, or you're getting that wrinkling that you see through the chest that can be very difficult to see, LED is a really good at-home treatment for this. You do, like Dr. Maxfield said, you have to be consistent pretty much with anything to see good results, but especially with LED, you need to be using this at least 3 times a week for at least 3 minutes a day, sometimes for 10 minutes a day, especially on the neck.
And one of the, I think, most discouraging factors here when you're talking about catching up, so if you didn't protect and prevent the damage on your neck, catching up is largely going to be in office. So the rest of the procedures and devices and all these things are going to be things you're probably going to need help with from a professional. Continuing on the light train of thought, is you have IPL, or intense pulse light, or some variations of light treatment. The benefit for this, because remember, poikiloderma is a combination of blood vessels, light and dark spots, which makes it difficult to treat with something very selective like a laser. It's not that they won't work, because some can work excellently, but something a little bit imprecise, like IPL in the right hands, can really do wonders for something like poikiloderma.
And the advantage of IPL, this is an in-office treatment. This is not something that you should be necessarily doing at home for discoloration. There are at-home IPL devices for hair removal. This is separate in a way. So BBL, IPL, same thing. This is something that's done in the office. It uses high energy light and different wavelengths to basically attack these different things. And they can use different filters to go after red, to go after brown. This helps to target those and actually get rid of them completely. Now, I would say IPL is the device that I see the most injuries from in the office. If you use the wrong settings, the wrong filter, the wrong light, the wrong energy, the person has a tan, the person's skin is darker than they expected, all these things can really, really, really damage the skin. So most of the burns that I see on social media and in the office come from the IPL device. So be very, very careful when selecting a provider to have this procedure done. But IPL has incredible results for poikiloderma on the neck and the décolletage.
And then moving forward in the light technology, we did say lasers, and so fractionated lasers, Fraxel, can be helpful here. Again, a little bit more selective, higher energy, more concentrated, but it can help undo some of the aging changes of the neck. One of the things I still love, and I feel like I'm going to love this forever, but microneedling and even RF microneedling can have benefits here. It's going to structurally change the skin more, so you're going to notice a lot more improvement with textural changes. It can help with the tone a little bit, but really you're structurally going to change things and help with wrinkles, fullness, and then healthy looking skin.
And then next up, we could talk about some of the injectable options out there. Sculptra is very, very popular on the neck, where it basically, especially for tech neck, and started to biostimulate the collagen production because it's a polyalactic acid product. So basically it can stimulate your own body's collagen production, especially on the chest and on the neck. So it's a very popular procedure amongst dermatologists. You can also get Botox into your platysma muscles, and if you inject into it, it can stop those horizontal lines from being as obvious. And this is something that's also very popular. And the last thing is threads. I've seen a lot of thread procedures done, especially on the neck area. Now you have to be very careful because if these are placed too superficially in the skin, they can become very obvious and they can also look very, very unnatural. But this again is a procedure that can really tighten the skin on the neck.
And then another option that can provide really great results is oil therapy. It actually uses ultrasound to help modulate the skin. And we'll do a whole video on this though. So wait for that deep dive coming soonish, but we'll talk about oil therapy again later.
So there are a lot of options in the office once you go see your dermatologist that can help with both tech neck, poikiloderma, and of course skin cancer. We do a lot of PDT, photodynamic therapy, or even 5-fluorouracil creams on the chest to remove basically field damage that's caused a lot of precancers or actinic keratosis to the skin. This also seems to have a cosmetic benefit in my patients where it can get rid of a lot of that roughness, texture on the neck and on the chest. And so in a way, those are treatments for cancers, but at the same time can have a cosmetic benefit as well. So this is something you're going to want to see your dermatologist about. But in my opinion, save your money on your specific neck creams, focus more on good, really topical treatments for the face that you can then bring down onto your neck, and start wearing sunscreen on your face and neck tomorrow.
It's so much easier to be proactive than reactive, and this is the classic example for that. Think about it. All of the treatments we listed, they're extra, they're procedural, they're laser-based, they're light-based, or you can just bring your sunscreen and actives down to your neck. So be proactive, don't be reactive, and that is how you care for your neck.
Make sure that you check out the Skinpedia article on how to take care of your neck area. There's going to be a corresponding article with each video that we put out. That's going to be the written form of what we're talking about. Again, a very important passion project for me, so make sure that you check it out and see if you like browsing this, and you can search common skincare questions there as well, and we'll also link our videos in there as well. So thank you all so much for tuning in. Please like, comment, and subscribe, and we'll see you in the next video.
We'll see you next time.